Welcome to eHealth Radio. I'm Linda DeWitt, Director of PR and Media Relations at Community Health Network. Joining us is Jennifer Berry, an oncology nurse practitioner at Community, to talk to us today about Community's collaboration with the MD Anderson Cancer Network from a nurse practitioner's point of view. Welcome, Jennifer.
Thank you.
Tell us first about what you do.
So I have been a nurse practitioner here at Community for about 2 years. And on a daily basis, I evaluate and treat all the cancer patients that come into the clinic on a daily basis. So I see between 14 and 16 patients a day. I see them in follow-up from their chemotherapy or in follow-up from completion of all their therapies. But I also see them during their actual treatment visits where they're actually receiving the chemotherapy.
And you're seeing all kinds of patients with all different kinds of cancers, not any particular kind, correct?
Right. We see a variety of patients, breast, brain, lung, liver, colon, GYN, pretty much everything.
Runs the gamut.
Mm-hmm.
Jennifer, what led you to want to work with cancer patients? It seems to me that it would take a special type of person because there are so many more issues, including emotional ones, that cancer patients often have to deal with.
Yeah. So when I was in high school, my mother was diagnosed with breast cancer. And science has always been where I excelled in school. And that just kind of propelled me to know exactly what I wanted to do in life was to be in the healthcare field. So I started with nursing. I went to the University of Southern Indiana and then came up here to IUPUI and got my nurse practitioner. And oncology is just where I fit in. Having a mother go through it and seeing it from a daughter's perspective, especially being so young and in high school, you just wanted to be able to do more and to help. And as a daughter, I couldn't do those things. But now as a nurse practitioner, I can have sympathy for them, empathy for them, from the standpoint of being a family member and now as a provider. So,
as far as the MD Anderson Cancer Network relationship that Community has, what does this really mean for patients and families? I mean, if you can put it into perspective for consumers as far as what the relationship means, I think that would be helpful.
I think the relationship is opportunity. It's opportunity for the patients to have more access to such a world-renowned network as MD Anderson, and to give them access to those physicians that physically they may not be able to get to in person, but we can help facilitate interaction through our physician peer-to-peer process.
How does it work? If a patient comes into our system and when they are treated as a patient, they are going through the standards, the protocol, so to speak, of the MD Anderson Cancer Program, what is the process?
So as a patient's coming in and let's say they get to a point in their chemotherapy where more options need to be presented, usually at the time of progression of disease. When it's decided at that point that a patient wants some varying opinions, Dr. Badia or any of the physicians in the group will present the patient with the opportunity to either go to MD Anderson or a peer-to-peer evaluation. The peer-to-peer is a physician-to-physician discussion, typically on the phone, where we set it up with medical records who will obtain all of the information that the physician at MD Anderson will need. We make sure that it gets down there.
So this is our community physicians here in Indianapolis talking to MD Anderson cancer physicians in Houston.
In Houston, right. And the physicians have the opportunity to review all the radiology slides, all the pathology slides, to really understand, what this patient's disease state is at diagnosis and current, to be able to give another opinion for the patient.
So it's really a second opinion for the patient, and our doctors have access to the doctors in Houston for that consult.
Yes.
Excellent. This is better for the patient when they're in a program like this because of the standards that are in place. But what are some of the other benefits? And we might also talk here about the family's involvement.
I think it provides reassurance to the family. Sometimes patients aren't physically able, not only financially, but physically able to make that travel to MD Anderson or to another institution for an opinion. So it just helps to provide them reassurance that what we're offering is in line with what another institution would offer.
And we should probably point out, too, that having this collaboration doesn't mean that a patient has to travel to Houston. In fact, it means the opposite. They can get that standard of care in Houston here in
Correct.
Central Indiana.
Mm-hmm.
But there is that option, if necessary, they could be referred there.
Mm-hmm. And I was told today that about 80 patients have taken part in the peer-to-peer process, and of those 80 patients, about 19 have actually went down to MD Anderson, either for a clinical trial or the physicians felt that they actually needed a face-to-face evaluation of the patient, which does occur before they could give a full opinion.
Mm-hmm. What about opportunities for clinical trials and research under this program?
They've been immense. We've had patients who have even come to us from outside institutions who want to go on a clinical trial, and not only do they get the opinion from our group, but they actually, we help them facilitate their travel and coordination of getting them to MD Anderson and finding them the appropriate clinical trial that best fits their needs and their goals for their care.
Mm-hmm. Excellent. So really having this available to patients here and really to their families, it's all about the patient experience, and this is just an incredible one, having access to a world-renowned cancer network. And so it's probably more assuring for families as well, knowing that their loved one is getting that standard of care.
Definitely. We've had, I can think of one patient in particular that had a very unusual type of lymphoma, and it was so reassuring to the patient to not only get the opinion of Dr. Badia, but also to have the peer-to-peer. In his case, it wasn't an actual just one physician to physician, and it was actually a group of physicians from MD Anderson who reviewed his entire case, and everyone gave their opinions in the group, and those opinions were presented to the patient by Dr. Badia. And, so he didn't have just one or two opinions. He ended up with a couple of opinions, and he was able to make the choice that fit him and fit his needs and his family's needs.
Thanks so much for joining us, Jennifer Berry, an oncology nurse practitioner here at Community Health Network. Thanks for listening to eHealth Radio. I'm Linda DeWitt.